Complementary and alternative medicine, often called CAM, includes a wide range of health practices. These practices are used alongside or instead of standard medical treatments. CAM therapies can include things like acupuncture, massage, yoga, meditation. They also include the use of natural products such as herbal remedies, dietary supplements. Many patients use these therapies to manage chronic conditions, improve their well-being, prevent illness. As a nurse, it is important to understand what CAM is. You will encounter patients who use these methods as part of their daily health routine. It is your role to be knowledgeable and non-judgmental. Herbal remedies are a major part of CAM. These remedies use plants or plant parts to promote health, treat symptoms. They can come in many forms, including teas, capsules, tablets, extracts, fresh or dried plants. For centuries, cultures around the world have relied on herbal medicine. Today, many people see them as a gentler alternative to conventional drugs. It is crucial to remember that these remedies are biologically active substances. They can have powerful effects on the body. Their use requires careful consideration, knowledge of their properties to ensure they are used safely and effectively. Many people believe products labeled natural are inherently safe. This is a common and dangerous misconception. The term natural simply means that the product comes from a plant or other natural source. It does not mean the product is free from harmful effects or risks. Many potent poisons and toxins are also 100% natural, such as arsenic cyanide, botulinum toxin. Likewise, herbal remedies contain active chemical compounds. These compounds can cause significant physiological changes in the body. They can be just as powerful as the active ingredients found in prescription medications. The lack of regulation for herbal supplements presents a serious safety concern. Prescription drugs undergo years of rigorous testing to prove they are safe and effective. Herbal supplements do not have to meet these same standards. The concentration of the active ingredient can vary from one batch to another. Some products may not contain the amount of the herb listed on the label. Worse, some supplements have been found to be contaminated with heavy metals, pesticides, prescription drugs. This inconsistency makes it difficult to predict how a patient will react to a specific herbal product. Herbal remedies can cause side effects just like any medication. The NCLEX exam requires nursing students to have a foundational knowledge of common herbal remedies. This is because their use is widespread among patients. You will be expected to know why patients use these herbs and what risks are associated with them. Understanding these key herbs will help you answer patient questions and identify potential safety issues. The NCLEX focuses on herbs that are frequently used and have significant clinical implications, including important drug interactions. Being prepared to discuss these remedies is a key part of modern nursing competency. The list of herbs you should know for the NCLEX is specific and clinically relevant. You do not need to memorize every herb in existence. Instead, focus on the ones most likely to appear on the exam. These commonly tested herbs include cranberries, saw palmetto, echinacea, GINKGO. You should also be very familiar with St. John's wort, milk thistle, garlic, black cohosh. Cranberries are often used to prevent urinary tract infections or UTIs. Cranberry does not treat an active UTI. High doses. Gastrointestinal upset. High doses. Increased risk of kidney stones. Cranberry may enhance warfarin's anticoagulant effect. Increased bleeding risk. Saw palmetto, used for benign prostatic hyperplasia, BPH. Saw palmetto side effects, generally mild. Saw palmetto can have antiplatelet effects. Use caution if taking anticoagulants. Echinacea, used to boost the immune system. Short-term use, generally safe, can cause allergic reactions, especially with ragweed allergy. Long-term use may suppress the immune system. Avoid in autoimmune disease and transplant recipients. Ginkgo biloba, used to improve memory. Major risk. Increased bleeding. Do not take with warfarin. Do not take with aspirin. Can increase seizure risk. St. John's wort, used for depression. Induces CYP450 liver enzymes. Speeds metabolism. Many drugs less effective. Affected drugs. Oral contraceptives. Never combine with antidepressants. Risk of serotonin syndrome. Garlic, used to lower blood pressure and cholesterol. Client education is a cornerstone of safe nursing care regarding herbal remedies. Your first step is always to ask during every medication history about herbal products, vitamins, and supplements. Once identified, document it clearly for the entire healthcare team to see. Explain that natural does not mean safe and discuss potential side effects. Encourage patients to inform all healthcare providers about every supplement they take. Pregnant and breastfeeding women should avoid most herbal remedies due to unknown effects on the fetus or infant. Some herbs can cause uterine contractions, leading to miscarriage or premature labor. Older adults are at higher risk due to multiple medications and age-related changes in metabolism. Review their complete medication list, including all supplements, at every visit. Your role as a nurse is to be a patient advocate who prioritizes safety through education and assessment. Remember, St. John's wort with antidepressants can cause life-threatening serotonin syndrome. This vigilance protects patients. Serotonin syndrome, or SS, is a condition that occurs when the metabolism, synthesis, or reuptake of serotonin is affected by concurrent medication use, resulting in serotonin accumulation. Concurrent use of St. John's wort with antidepressants such as SSRIs increases the risk of serotonin syndrome. Manifestations include mental status changes like confusion and anxiety, tremors, hypertension, sweating, hyperpyrexia, and ataxia.